So let me briefly introduce our distinguished speaker. Dr. Unni Karunakara is a Shinhan Distinguished Visiting Professor at Yonsei University. He is also visiting faculty and leader in residence, Schwarzman College, Tsinghua University, and Assistant Clinical Professor of Public Health, Yale School of Public Health. He also served as the international president of Doctors Without Borders from 2010 to 2013. He has extensive public health experience in the humanitarian field in Africa, Asia, and the Americas. His research focuses on the demography of forced migration and the delivery of healthcare service to neglected populations affected by conflict, disasters, and epidemics. So without further ado, I would like to welcome our distinguished speaker for today, and I would like to give it over to him. Thank you, Dr. Unni.
Hi, can you hear me? Yeah?
Yes, we can.
All right. So thank you, Yonsei, for that introduction, and thank you, IEU, for inviting me to join you all today. What I'll try to do is I'll hit very generally some of the topics that you mentioned, Yonsei, and then I hope that we can get into a bit more depth in the discussion. So I won't go in really great detail because we only have an hour. So I'll just talk generally, and I won't get into the science. I'm just going to talk about response and other issues and not really get into the virus and the immunology and the epidemiology of it that much. Just enough to sort of make my point on certain issues. So what I'm going to do is let me share the screen. And okay, can you see the slides, everybody? Yeah?
Yes, we can.
Right, great. So let me get started. What we'll do is we'll keep questions till the end, right? And Yonsei, you'll moderate, you'll sort of collate the questions, and if you want to ask somebody. All right, great. All right, so this is the situation today. China first reported COVID-19 to the World Health Organization on 30th of December last year. And in the 4 months, we have had at least more than, at least 3 million cases now that have been confirmed. In all reality, the number is likely to be much, much higher. And we can talk a little bit about that later. US alone crossed 1 million cases yesterday. So we are looking at a real bona fide pandemic, the first in about 100 years, and this is perhaps the worst health crisis that we've all seen so far. Now, what has happened? What has happened is that even though the outbreak sort of developed into a major epidemic in China, the epicenter has moved over time from China to Europe, and now the epicenter is very clearly in the US. All right, now if you look at response strategies, there are basically 2 strategies. One is suppression, and the other is mitigation. So suppression, basically, you want to really hit hard, come down, keep the cases low, and then maintain the situation at that level. So it doesn't get out of that. It doesn't mean there are no cases, but it is that you keep it at a very low level so that the health system is able to detect very early and do what is necessary. Mitigation is basically slowing down the spread because it's just perhaps the health system is overwhelmed, they don't have the capacity. So what they want to do is try to sort of reduce cases to a level that the system can actually handle it. So it sort of looks at healthcare capacity that's available, and then they look at how many cases they can handle, etc. And then, of course, they're trying to protect the at-risk patients. But whatever strategy you decide upon, the tools in your toolkit are basically testing. You trace the patients, not just patients, but all of the contacts and all of the and also the highly vulnerable, high-risk patients, and then you treat. Now, of course, in COVID-19, so far there is no treatment, but I think a lot of measures have been put in place to make it possible to manage the patient rather than treat the patient. Right? Now, just look at some country experiences. So it started off in China, like I said, and it very soon came to Korea. So the blue line under Japan, what you see is South Korea. And you see the experience of China and Japan, South Korea. They acted, in fact, South Korea acted much more decisively very early. They switched into pandemic response mode even before the cases were detected. And so when the case hit, which they knew it would, they were able to sort of hit the ground running. China, after initial problems, they got their act together, and very draconian measures were put in place. But the result of both is that you probably heard the term, they flattened the curve. So basically, they have steadied the number of cases, number of new cases every day is actually almost come down to zero, right? So that's the situation in China and South Korea. But in Japan, after initial talking about control, etc., what we are now seeing, or at least what Japan is reporting now, is a second wave of infection. So cases are still sort of on the up and up, right? So there are more cases every day. So now, interesting to note that China and South Korea approached the problem very differently with somewhat similar results. And we can go into what the differences in approaches are a bit later. Now, then from this part of the world, it moved to Europe and also Iran. And you saw that the countries have chosen very different approaches. So in Sweden, you have a very relaxed, what they don't even call it a lockdown, they call it, in Holland, they call it intelligent lockdown. Sweden is a bit more relaxed, but both Sweden and Holland took the approach that our societies are mature societies, and we shouldn't be sort of impinging upon the rights of people. We should allow them to be responsible, take responsibility, while in Italy and Spain, etc., what happened was it hit the high-risk population very early on. So mortality just started going up. So they had to kind of come down really hard. Now, it is interesting to note the experience of Iceland and New Zealand here as well. These are two countries who also sort of took measures very early on, and as a result, they have things under control. So they are now able to say that we know what's going on, we are able to handle it, and they are able to slowly limp back to sort of normality, if you want to call that. And we can also talk a little bit later, will it ever be normal, right? So that's where Iceland and New Zealand are. Sweden, we will explore that a little bit further later. Germany has done very well, Italy, Spain, of course, after very early sort of huge mortality. They are also now able to say that they are bringing the pandemic or the outbreak under control. Now, from there, of course, we have the experience of United States. Now, United States and Korea reported their first cases on exactly the same day. Korea acted, United States didn't, and you can see the results of that. You have 1 million cases as of yesterday, and mortality rates are going down. And we can talk a little bit later about governance and the importance of governance in a pandemic situation. Then, of course, the areas that I'm concerned about, because a lot of the work that I've done in my career have been in really resource poor settings. So if you look at, that's where the next, where it's all going to play out next, in continent of Africa and some other really poor parts of the world, where you see the cases are going up. And we'll talk a little bit more about that later. So you can see the progression of the pandemic from east to west, and now it's going to the south. Now let's talk a little bit about testing and why is testing important. So now all of the countries that are getting to a point where they say that they have things under control have tested heavily. So they rolled out testing in a massive way, and they were able to very quickly get a sense of the epidemiology of the disease in their country and take measures to act. Now, what exactly happens when you get an infection, right? So you have, when you get an infection, you have the virus inside your body. So the tests that we use in Korea, for example, it's a viral RNA test. It actually tests for the RNA of the virus. But when you stop infection, and then of course, when you have an infection, as you are getting over it, the body develops an immune response and develops antibodies. And there are different kinds of antibodies. And the antibodies that are important for us are the IgM antibodies, which are almost always the first antibody response when you have an infection. And then you have the later, longer lasting IgG antibody sort of response as well. So now the tests that we have, there are two kinds of tests. We have the RNA test. That's the one I got tested last week when I arrived at the airport. It's a good test of whether you have the infection or not. But it doesn't tell you much about exposure, because we know from Iceland, and we are hearing also from India, Iceland said that 50% of their positives are asymptomatic. All right. So you have a lot of asymptomatic people. If you don't test them, you don't know whether they had the infection or not. And it is also important when you want to talk about how many people have developed immunity. So that's why the antibody detection is very important. So it sort of measures our immune response to the infection. Now, if you get chicken pox, or you have pretty much immunity for life, right? In some cases, you can get it again for the second time, but chicken pox sort of affords lifelong immunity. But all early indication is that COVID-19 antibody response does not last for life. It'll last perhaps for a year, 2 years. Even that is something that scientists are trying to determine what the response, antibody response to SARS-CoV-2 or COVID-19 infection will be. But these tests serve different purposes. So for example, 6 months from now or a year from now, if you want to do a survey and say, how many people do we, as a society, as a community, have we developed a very high level of immunity? What has been our exposure? to COVID-19 virus, then you need to do an antibody test survey, right? So the companies are now trying to very quickly develop these small rapid tests. And the importance of the rapid tests are you can get a result in 15 minutes. Now, of course, the thing to watch out for is to have tests that are highly sensitive and highly specific. Sensitivity basically means that when a test is positive, you can be confident that the person is positive to the antibodies. And specificity means when a test is negative, you can be certain that the person does not have an antibody to COVID-19. Now, testing is absolutely essential if you want to that's the cornerstone of the response. So if you look at these, this was in March, if you look at it, very few countries had actually ramped up testing capacity. So South Korea was best in class. They had really, within 1 week of identifying the infection, China had released the COVID-19 genetic structure, and based on that, tests were made, and South Korea was ready to ramp it up when the infection happened. Other countries took much longer to sort of get their act together. So the situation is pretty much like this now, where United States is slowly increasing their per capita testing. The highest is perhaps UAE and also Iceland, which is not on the chart. They've done extremely well. Iceland, for example, have tested 15% of their population. Now, the objective of testing is not to test everybody in a country, but it is to test all of the people who are at high risk so that you can start you can identify contacts and you can start sort of breaking off the chains of transmission. And we'll come to that a bit later again. So this is as far as testing is concerned. Now, tracing, what happens in tracing? So tracing is basic. First, you have to test to know who has the infection. And then what you do is you identify all of the contacts, and then you sort of isolate them or you quarantine them, and so that they go through their infection period. They either develop the disease or they don't, and then they cease to be sort of infectious. Now, one interesting thing about COVID-19, unlike previous infections, is that there is some evidence that asymptomatic people can spread the disease. So that's problematic when it comes to how do you actually go about tracing. And, before, if someone starts sneezing and someone has a cough and a fever, okay, you immediately, because that's when people became symptomatic. So it was easy. There were symptomatic sort of tells that would say, okay, now is the time to isolate or quarantine. But when you're asymptomatic, it makes it all the more important that you trace and you quarantine people early on. So this is what happened in South Korea. So you all know that the first case happened in Daegu in the Shincheonji church. And you can see that the majority of that cluster that infection spread out from that church, and close to 5,000 cases in Korea originated from that person in that church. And this is a pretty impressive graphic. So what Korea tried to do, and their whole concern was, well, it's in Daegu, let's control it in Daegu, because if it gets to Seoul, then the situation is very different, because Seoul is 60% of the Korean population lives in the Seoul, Incheon metropolitan area. And if it gets to Seoul before we have our act together, then it could be a potential disaster in the making. And Korea basically got their act together. So initially, the church refused to release their membership information, and Korea had to take very strong measures, including criminal action against the head of the church, and he apologized on live TV, released information, and of course they were able to control. So it is in times of pandemic, sometimes extraordinary measures have to be taken in order to reduce risk to the public. The other thing, and this is a graph from Iceland to show how good their tracing was. 54% of those who were diagnosed positive were already in quarantine. That means they had actually traced all the contacts, they got them, they isolated them, they put them in quarantine, and then when people tested positive, they were already in quarantine, isolated. What this means is their ability to spread the disease has been curtailed in a very big way. So infections they've sort of effectively managed to cut down the spread of infection. So these sort of measures, tracing is actually very, once you test, the next big, very important thing is to trace all of the patients and take appropriate measures. Then, of course, treating. Like I said, we don't yet have a vaccine or we don't have a treatment as of now. There are several candidates. There's one Oxford vaccine that is now going to be tested and produced in India. And there is another one that is also, there are two candidates that are sort of racing ahead. And they think that at least the Oxford vaccine, they seem fairly confident to have something by September, but most scientists say it'll be much longer before we have a vaccine. Now, what are the measures that you can take? You hear all these terms, so you have social distancing, you have quarantine, you have self-isolation. They all basically try to limit the spread of the disease, but they vary in the severity of measures that are put in place. So social distance is basically the government just gives guidelines, stay 1 meter apart. Some countries it's 2 meters, and they say, please be careful, all of that. So social distancing is what is in place in Sweden, for example, right? Quarantine, 14 days minimum. So I'm in quarantine for 14 days. In India, the state where I come from, in Kerala, they have said that, well, they still are seeing patients testing positive in weeks 3 and 4. And they think that the quarantine period should be 28 days. So these are all sort of trial and error. I think Korea has done quite well with the 14 days. So they've tested us 2 weeks ago. They'll test us again tomorrow. So with 2 negative results, we can be fairly certain that we are not positive and we are at very low likelihood of spreading the disease. And then, of course, self-isolation, people who have, so in Holland, for example, you really have to be a very serious case before you even get a test. So basically they say, if you have these symptoms, stay at home and isolate yourself and only come to the hospital when it gets actually serious. And with what we know clinically now about the disease, and as a strategy in Holland, this hasn't really worked very well. So testing, again, is very important. And the important thing is to get to a clinical facility early enough so that clinicians can manage any eventuality. Because the moment you get onto a ventilator and moment you get intubated, your risk of the risk of mortality goes really high. So you want to be able to get medical care to a point so that you can prevent getting into intensive care or even get to a point where you would need a ventilator. So that's clinically, that's the objective. Now, this is also, you've probably seen graphs like this in newspapers and on the internet a lot, but it gives you a graphic. These are for illustrative purposes only, but with different measures, you see the impact on the number of cases. So this is also what they mean by, so you're trying to flatten it to a point where it makes it manageable. Either you suppress it completely, or at the very least, you want to make it manageable for the health system, right? And the speed with which you act is also very important. So even a day's difference sort of has a big impact on the number of cases that the system will end up system will encounter. So it's also important the speed with which you act and the measures you take. So early action is very, very important. Now, let's look at Sweden. So everybody's talking about, oh, Sweden's doing so well. And so this is a comparison between the policies that were, the measures that were put in place in the Nordic countries. And I would like to add Iceland as well. Iceland, pretty much like Denmark, they just sort of tested, they went big on testing, and they sort of put all these measures in place. So Sweden, as you can see, is pretty relaxed. Even you could go get a haircut, which you can't get in most countries around the world today, right? So they said, okay, respect, safe distancing. And the only measure they said, okay, let's cut down large events. So concerts, big conferences, etc. were stopped. So what is the result, right? And this is the result. You see that mortality per population, so deaths per 100,000 is very, very high in Sweden. Denmark has a much higher density of population, but their deaths per 100,000 is actually much lower. And so is the case in countries like Iceland, etc. One more thing I want to say is some countries, so South Korea, Taiwan, Hong Kong, New Zealand, Iceland, etc., they are also geographically blessed in the sense Korea has a northern border that is completely sealed. Hong Kong is also a peninsula where there's a control across the border that is very strong, and all the others are islands. So what this means is that they are able to, in addition to being very proactive, a lot of these countries also had, it's not trivial, I think it might prove to be important in some sense. They all, majority of them had female leadership. And second, they all were very quick to react. So these countries were able to get things under control also because they were able to control their borders much more effectively, right? So when I suggest this, people react in Iceland, they say, oh, don't lessen our achievements by calling us an island, which is true. They've all acted very early on to put measures in place, but I think being geographically sort of isolated also helped them control this much earlier than it's possible in other countries. Okay, now the three other areas, and this is something that we've learned from the Ebola outbreak in West Africa, is the timeliness is absolutely important, right? You have to act very early on. Now, an important fact is also that Korea, the state of Kerala, in India, where they're doing really well, Hong Kong, Singapore, all of these places were also primed to respond because they all had, in the past few years, a significant outbreak. So the system had already, they were well-oiled machine. While in Europe, in the US, etc., they haven't had to deal with such a situation in the last, I don't know how many years. So they were primed, their machinery was well functioning, they were trained, stocks were positioned, their guidelines were in place, so they were able to act in a timely fashion. They also had the resources. For example, and that's not an insignificant thing. The amount of money South Korea has put into response is just mind-boggling. Very few countries, even in Europe, can put these sort of resources to bear in their response. So just testing is more than $300 per person, right? And so you can imagine countries in Africa and some Asian countries, you can forget it. In fact, most countries, even in the US, to bring that kind of resources to bear would be very difficult. Second is teamwork. You can't do it alone. And also it's teamwork because you need global solidarity, but much more importantly, the government, the people in charge have to work together with the population. Now, in all of the countries that they are able to bring this under control, there is a certain trust that the communities have in their government. So they're much more likely to accept policies and abide by it, while let's say in a country like UK and Holland, etc., they actually sort of reject it to some extent. They say we can, we are intelligent people, we can make up our own mind. While in all of these countries, they trusted their government enough to abide by the policies that were put in place. And the other thing is transparency. And in order for trust to happen, you need transparency. And this is a big difference between, let's say, how China approached it and how Korea approached it. So Korea, they both, and we'll talk a little bit about some of the tactics, how information technology was used to sort of address this. China, there was much less transparency than, let's say, Korea had. And both are problematic in very different ways. We'll talk a little bit about it in the next slide. Right? So this is Yuval Noah Harari. You probably read his book, Sapiens, but it was very important that he stated this recently. In this time of crisis, we face two particularly important choices. The first is between totalitarian surveillance and citizen empowerment, and the second is between national isolation and global solidarity, right? So these we can discuss this, both of this in the next few minutes. So let's look at the first point that he raises: totalitarian surveillance. So, and information technology has absolutely been key. And Yuval also talks about that in this pandemic, we've crossed a line from over-the-skin surveillance to under-the-skin surveillance. And we'll talk a little bit about this. So one of the first things, like in Hong Kong, for example, and in Singapore, they've used Bluetooth technology to sort of look at who's coming in contact with whom. So this is actually quite, basically the government knows at all times where you are because your GPS is tracked, and then they can track it against other GPSs, and they can say, okay, they can notify people, etc. So this works to some extent, but as we speak, this technology is being perfected, and sort of they're trying to use it to do contact tracing. The other thing is Bracelet. In Korea, we don't have a bracelet, but in Hong Kong and in Singapore, when you come to the airport, you have to download an app, but you also have to wear the bracelet. So you can't leave the phone at home and go walk about, because then they are able to detect it. But in both Hong Kong and in Singapore, they had problems with this technology. A lot of the bracelets didn't work. But the idea behind that is very clear, that you can't cheat the system, or you cannot try cheating the system, right? So that's another level of enforcing sort of quarantine and isolation, self-isolation, right? Another technology is travel logs, and Korea is pioneering this, that they can actually, when a patient is identified as being positive, they publish travel logs. Now, some of it, it was initially started by citizens with IT sort of expertise. They started publishing it, but now the government is also doing it. In fact, in Korea, there's a demand for more information. So Korea is actually releasing more and more private information in much greater detail. There are real privacy concerns. And there's been people being ostracized and businesses, just because someone went past a coffee shop, these coffee shops are now sort of, no one is going there and they're having to shut down, even though there's absolutely no risk going and getting a coffee at this coffee shop. So they have huge social implications. And the other one is from my state in Kerala. They are also publishing sort of, okay, patient number 22 had lunch at this hotel, then took a public transportation at this time, went to see a relative, etc., etc., etc. So the public can actually look at it and then self-report themselves and say, I was in the same bus as this person, can I get a test, right? So these travel logs are becoming more and more important, but you lose more and more of your privacy. Then you have thermal scanning. So in many sort of metro stations, etc., they have installed what's called an electronic fence. So they can actually detect your GPS, but also they can see who has a fever, who doesn't have a fever, etc. Then you have drones that are being used in China, and these are actual verbatim translations of what the drones tell people. So suddenly there's this drone telling this woman, yes, auntie, I'm speaking, this is a drone, and we're speaking to you, go home, stay safe. And so you can see some of it is actually quite funny, but this is the future. We will have people watching us 24/7 and modulating our behavior and telling us to go home, or sort of reprimanding us if we didn't behave in a way they expect us to behave. And then you have cyber, this is in Israel. They're using, for the first time, military-grade technology in peacetime, right? And of course, the concern is that once you start using technology like this, it's very difficult to roll it back in peacetime. So almost every country that is responding to COVID, they are using information technology to some extent. The question is, how much transparency is there? So Korea, they have said that they will, once the pandemic is over, they will roll back all of this. But that's not an absolute guarantee in a lot of other countries. So for example, cyber surveillance in Israel is under the Secret Service in Shinhan, and they have no requirement for transparency under Israeli law, right? So it's very difficult to hold them accountable for any abuses they may perpetrate, because this was technology that was developed to surveil Palestinians, and now they're using it on COVID patients. All right, so now what are some of the challenges that we are facing in the places where we work? Okay, oh wow, time. In Africa, for example, almost every country has now reported cases. The modeling suggests that by the end of the week, all African countries will have their 1,000 cases, and then within a few weeks, we'll have 10,000 cases. And the demand for beds will critical care beds will far outstrip demand. Now, there are real challenges. So you tell everybody to wash their hands, wear masks. How do you do that in places where there is no supply of running water, as you can see in refugee camps? Physical distancing in refugee camps in an urban slum situation is absolutely very difficult to do. And then, of course, measures like lockdown just increases the risk of poverty, hunger, violence, etc. So there are real social sort of considerations and social consequences to any measures that you would put in place. But what is very clear is that suppression measures that were put in place, like in Korea, are unlikely. First of all, countries don't have the capacity to, or the resources to put that in place in most countries around the world. So it's likely to succeed. So the best you can look at are mitigation measures, right? But to what extent can they even do that? Now, you can see, so one thing about lockdowns, you've heard the word lockdown a lot. Lockdown is a very blunt instrument. Very often countries employ lockdown because they are not able to ramp up testing to the level that is required to be able to trace patients and to sort of contain them. So you have, like, India is going through the largest ever lockdown the world has ever seen. And then, of course, you have the consequence of that is that there are a lot of people who've lost livelihoods, who are not able to even get food, and they have to rely on handouts if that is available. So the social consequences of this is going to play out. Even in a country like the US, millions of people, we're close to 10 million people, maybe more, have filed for unemployment. And unlike in Europe, in the US, if you lose your job, you lose healthcare. People don't have access to health insurance. So all these consequences. Now, some of the challenges, health systems in let's say, the continent of Africa are not the best. But one thing that we have realized, it doesn't matter whether you're rich or poor, your systems can fail. So USA, in the United States, the system has failed miserably. They're a well-resourced system, but it has failed, right? And a lot of the health systems in Europe has failed. So failure, you're seeing failure in the rich countries, and you will see failure also in poor countries, right? Human resources, they're way, the numbers of people that are available to respond to a crisis is way fewer than you would see in rich countries. So even being able to sort of rush in and support them, like humanitarians are likely to do in the past, is also difficult, because a lot of these countries are now saying we don't want foreigners coming in, right? And this is a twist of irony. In Ebola, all the rich countries said we don't want people from Africa coming in because they bring Ebola to our countries. And now the poor countries are saying we don't want foreigners, we don't want white people coming to our country because they bring COVID, right? So the tables have turned a little bit. But the consequence, the downside of that is it's also very difficult to rush in support, bring more people in to help with the effort there, because countries are, for example, in South Sudan, the first positive case is being a UN staffer in South Sudan, and as a result, they've closed. They've had to give all foreigners protection because there's xenophobia and there's real danger to foreigners in these countries. Supply chain, as you can imagine, there's a real competition for resources. So the US is sort of, in a very unhealthy way, outbidding other countries for protection materials, any eventual therapies, vaccines, etc. So there's no guarantee that these poor countries will get a vaccine in a timely fashion when it is available, or even treatments for that matter. Global solidarity, instead of coming together, there's a blame game going on. You all know everybody's blaming China at the moment. One thing I want to say, maybe there was a cover-up, maybe all sort of, they could have acted quickly, but comparing COVID-19 to SARS outbreak, the speed with which China has reacted is just night and day. There's a huge difference. So China acted way, way more quickly and have been much more open with information in COVID-19 than they were with SARS. And then, of course, access. I told you a little bit about that. These countries may not have access to protection materials, vaccines, treatments when they need it the most. Now, programmatically, I think one of the most important things that we can do is protection of health workers, because if we can't cater to the entire population, what we want to do at the very least is to keep health workers safe, because that is the way you preserve health capacity to be able to, because if health workers keep dying, then you're further depleting the system. So you want to keep them, you want to protect them, you want them to have all of the protection materials they need so they can continue to treat people. So this, for me, is an absolute important priority in a continent like Africa. The other thing that I want you to think about is a little bit about the strategy that we are used to employing in outbreaks. So for example, Ebola, is that you have a population and you have a subset of that population that has been infected, right? So what you do is the subset of the population is then isolated, and then our efforts are to prevent the chain of transmission. You want to stop the infection from getting from the infected to the general population, right? So you break the chain of transmission, you bring the outbreak under control. But in COVID, the situation is very different. You can assume that almost the entire population is already exposed to COVID, right? So if you want to bring down mortality, what you want to do is you want to protect the high risk. So here, what is happening is the other way around. You're shielding a small group of population from getting infected, right? You get the difference, right? So one, you are preventing the population from getting infected, and the second, you're sort of preventing the high-risk people from getting infected. Now, even this strategy, how we go about implementing it in poor countries will test the ability, all of their systems, and their ability to sort of enforce some sort of discipline in how they're able to do it. Because the downside or the danger is you collect all the high-risk people in one place, and then if for some reason the infection gets in, then it can be disastrous, like it did in Italy, because it hit the old age homes, and then it just sort of decimated the elderly so you have to be very careful. One possible solution is what we are seeing in state of Kerala in India, is that the government gave everything families need to protect their own high risk, their elderly, their chronically ill, etc. And that has actually worked very well. So you're putting the onus of protection on families. So you give them everything, you deliver food at home, you give them masks, you give them everything they need, but then they are responsible for protecting their high-risk family members. I'm coming very close to the end. Implications for climate and environment. Very quickly, I mean, you see pictures every day about clean air and skies, etc., and that is a fact, right? So with fewer planes, with less traffic, with industries shutting down, etc., there's a decrease in carbon monoxide in the air. Carbon emissions have gone down, and improved air quality means that fewer people in hospitals with respiratory illnesses. So that's a good thing. But on the negative side, there is a huge increase in medical waste, masks and everything that we need to throw away. And this is going to increase over so there's a positive, there's also negatives. The important thing, of course, is how do we come out of it? Are we going back to normal? And normal implies, are we going back to the situation we were in? And this is something that an organization like Green Climate Fund should start thinking about. Maybe this is the time to nudge how people come back, or how people perceive what normal should be, and how you put policies in place so that they can get to a new normal that is earth-friendly, climate-friendly, etc. So one of the things that you've probably heard a lot is wildlife. And what happens is we will see outbreaks like this more and more, because we are encroaching into animal space. And every now and then when we encroach into animal space, what happens is a virus skips from the animal cycle to the human cycle. Sometimes nothing happens, but sometimes you have COVID-19, right? So there's no predicting what can happen. So that is also very important. We have to sort of, our relationship with animal spaces, forests, etc. We have to really start thinking about it, and we have to look at how meat is consumed. And it's not just wet markets in China. If you look at how meat is produced in the United States, that's also problematic. Factory production of meat is also something that we need to start thinking about. So we have to really rethink our relationship to other species on the planet, but also to the forests and animal ecosystems. The other thing is we have to start. We need a new kind of economy. So a lot of stimulus packages are now, all countries have stimulus packages for businesses. This is the time for Green Climate Fund and other advocates to sort of engage and ensure that these stimulus packages are greening the economy rather than acting against it. Because the problem could be that when you bounce back, it could bounce back in a way that is much worse for the economy. So this is an opportunity for GCF to insert itself in economic discussions, policy discussions, and make sure that all of the packages are considering green, they have green considerations. And then we need an economy that is more inclusive, caring, ethical, etc. These are, we keep talking about it, but it's very difficult to realize, because we have consistently in the last century put profit above people, and that has its consequences. I was listening to Noam Chomsky earlier today, and this was the point he was making. This is predictable consequence of how we've structured our society and economy. So once again, I'm coming back to that quote between national isolation and global solidarity. It is such a, you can't think of, borders don't matter anymore. It's ironic that, virus very easily crosses borders, but yet our response is all about strengthening borders. And I think for some reason, policymakers refuse to realize that that's not going to help. You have to have a global response. So China and US better kiss and make up, and they have to respond to this together and with all of the other countries. And a country like Korea is now being seen as like a lot of African countries are now asking Korea, okay, tell us what you've learned. Tell us how we can implement it. So I've been part of some of these discussions, facilitating conversations between Korea and African countries, so that you can take the knowledge that we've gained here to other parts of the world. I'll stop here for now. I'm sorry I took so long, but maybe we can take a few questions.
Yes, thank you very much, Dr. Karunakara, for this comprehensive presentation. We've had about 45 people, and I see some doctors also joining us in their uniform and with their mask on. So feel free to still leave us some questions on the chat room if you would like, or if you turn on your video and signal to me, I would be happy to relay your questions to Dr. Unni and give you the floor. But already we've had some good questions. So I'm gonna group them. And then my first question is this. You kind of alluded to this earlier, but will we ever return to a normal life that we once had? A life without masks, hand wash gels, or social distancing? And then related to that, I think Andreas already sees this as a new normal. So can you depict this new normal in 5 words or bullets? That is the first question.
Yeah, it's very hard to predict. I have I of course, wish for that this is a wake-up call for all of us, and then we will adopt personal and societal sort of attitudes that are respectful of each other and respectful towards the planet, right? That's what I would wish for. But I don't think so. I think the leadership that we have today is unable to think, with some exceptions, unable to think inclusively. We govern by dividing people. We are, even in times of pandemic, when we need to come together, we are blaming each other for our problems. So I'm not very optimistic. So I think New Zealand is a good example, where the Prime Minister has shown really great leadership. And if we can take lessons from New Zealand and Iceland and Korea and the state of Kerala, where I come from, I think we will already have made great strides in sort of resetting our direction in a more positive direction.
Okay, thank you for that. So there was this question from Ani Ruda. What is the possibility of this virus strain mutating or growing resistant to the drugs that the patients are subjected to currently?
Yeah, and the virus is mutating already. I mean, it's been mutating it has mutated many times. Mutation in itself does not mean it's going to be bad and scary and kill a lot of people. Sometimes it mutates out, and sometimes it mutates. So usually the strain that causes a lot of mortality does not usually spread that far and wide. And the strain that spreads a lot might not cause a lot of mortality, right? So yeah, it is mutating. That's a fact. Now, whether it'll develop resistance, well, we still don't have a treatment to begin with. So that's something that we'll have to watch that space.
Okay, thank you for that. And then there was some concern for the especially poor countries, the least developed countries, for instance. So there was a question, what can an LDC, least developed country, do to introduce more effective early tracing measures? What can we learn from a small country like island states in this regard? And perhaps you could touch upon how countries like Sweden have been successful.
Well, Sweden, the jury is out whether Sweden has been successful. They say, in fact, their death numbers are going up and up. They have been very unsuccessful in comparison with their neighbors. So this whole notion of Sweden, UK, Holland, intelligent lockdown, herd immunity, there is no evidence so far that it has actually led to a decrease in mortality. What they say is 1 year from now, 2 years from now, the result will be the same in terms of mortality. the same number of people would have died in Denmark. And what we are doing in Denmark is basically suppressing everything, but they will have deaths over a long period of time, while in these countries, deaths will happen now, and then they won't be. We don't know. We will have to look back in a year's time, in 2 years' time, to see what the implications of their policies were. So Sweden, there's definitely no, the jury's still out on that. Now, what can we learn? I think, like I showed you in that graphic, I think the most important thing is to start testing the high risk, create protective rings around high risk people, and sort of make sure that they are not affected. Most of us in the next year or two will get COVID-19, and without any problems. We'll get a fever, it'll be a bit nasty, we'll get out of it, and things will be fine. Now, the question is, if you go through that experience, whether you will have immunity or not. Now, there will be some immunity, but it won't be lifelong immunity, most likely. If that's the case, then hopefully by the time in the next season, next COVID-19 season, next flu season, if we have a vaccine, we would be living, we would have annual COVID-19 shots that we'll have to take, so that, even if we get it, it reduces the severity of symptoms. So that's probably what it's going to be like for the next few years.
Okay. Another question about this supply chain inequality, globally. Is there a greater need for a concerted effort through an international organization for protection materials, distributing masks, for instance? Maybe the WHO? What is your take on that?
Yeah, so WHO is doing that. But like I said, there is a real competition. So, so the biggest supplier of masks and protection materials, etc., is China. So the government of China with Jack Ma Foundation, they have supplied a large amount of material to through WHO to Ethiopia, and they've tasked the Prime Minister of Ethiopia to manage these stocks and distribute it across the African continent. So that's already happening. Only caution that I would exercise here is that there's been evidence from India, from Spain, and from other places that the masks, protection materials, tests from China have not been of very good quality. So quality assurance is something that we need. We need to ensure that all of the materials, it's great to show your solidarity with people in other countries who are probably going to face the pandemic. But we also need to make sure that whatever help we support them is of good quality and can be effective. So that's been a big problem.
Okay, thank you. That was all the questions we received on the chat. However, if we could briefly talk about this, because I was personally touched by what you laid out as the ethical and moral dilemmas, in this COVID situation. And because I'm a Korean national too, I didn't really follow this, but in the wake of COVID-19, the South Korean government, actually the National Assembly passed the legislation that could significantly curtail people's human rights and privacy protection. And so even, the churches giving out their membership, list, this could have very significant implications. So what is your take? What can we do to ensure that there is a good balance between this, need for protection and then the need for privacy and human rights protection as well?
So there are several questions you can ask here. So first of all, it's a false choice. Either you have privacy or you have health. As citizens, we should expect both. So it's not a choice. Now the question is how you sort of balance it. So there's these set of principles called the Syracuse principles. This is, the ethical principles that guide pandemic response, outbreak response, etc. So Article 25 of Syracuse principles allows for suspension of personal liberty, personal rights in times of grave or public health sort of emergencies. But it also puts a lot of responsibility on the state to ensure that those rights that have been temporarily suspended are done in a sensitive way and then are restored as soon as the emergency is over. So that's key, right? So what is happening in South Korea, for example, they are triangulating GPS data with credit card information, with your, whenever you swipe your metro cards, etc. That's far too much information, and if that is not taken back, let's say in non-pandemic situations, that means the government has too much information about your personal comings and goings. Now, from what I understand, that legislation makes the provision for the government to roll it back. And even this getting information, they have to go through an approval process. Before, the approval process would take a day. Now the approval process can be had in minutes. Now it's up to the citizens of Korea to ensure that, well, the pandemic is over, now we have to go back. But that, I don't think, will be the case in a country like Israel, for example. A lot of these technologies that are put in place will be very, very difficult to roll back. So it remains a big concern. Again, I want to underline that we shouldn't get into the whole mindset it's a choice between privacy or health. We should have both, right? So we should demand both from policymakers.
Thank you very much for that. And yes, we still have about 36 participants, and I would like to ask you to please feel free to come in if you have any last questions for Dr. Unni. Do we have any more questions before we close this talk? It has been a very engaging discussion. Anybody else? Any GCF colleagues or medical doctors who are with us? Anybody who would like to join us? I mean, ask a question. Okay, I think that's all the questions that we would discuss for today. Dr. Unni, thank you so much for your comprehensive presentation. Really, I didn't hear so many, about these different aspects about the crisis situation, and it was really helpful for me personally. And then to all our IEU Talk participants, thank you very much for joining us. It was our first virtual launch talk, and it was very great to have you.
Thank you. It's a pleasure to. Thank you for inviting me, and I'm sure this is, COVID is. We are learning new things every day, so there will be much more to discuss in the coming weeks and months as we get more information about the disease. So we still don't have a full sense of the contours of this pandemic yet. So you have to keep engaged on these issues. Thank you.
Okay, Andreas, any last word from you?
No, thank you again, Unni. This was an excellent talk. We heard a lot about the different aspects of COVID in these very new circumstances that we are finding ourselves in. It was great to hear from you and your feedback and your expertise, in particular in respect to the questions of where are we going next, what should we be looking at, and I really cherish your arguments on the question of this should be a nudge to all of us to also look into other areas and other sectors such as environment, such as provision of effective materials and masks, and as well, a more concerted efforts from the international community to really deal with this and reduce any types of inequalities. So very, very great to hear that. Thank you very much.
So there is a huge thank you coming in from everybody. If you could look at the chat room. So once again, thank you very much, Dr. Unni. And to our participants, please stay tuned for our next IEU Virtual Talk. We will come back with more exciting materials. And I really do hope that Dr. Unni could join us again for another excellent seminar. Thank you so much.
All right, my pleasure. Thank you. Stay safe, everybody.